3, 2.
Welcome to the Preventable. Today I have with me the president and CEO of the St. Louis Area Foodbank. I know, it's just such a big title. Meredith Knopp, welcome.
Hi, Nicole. Thanks for having me.
You are more than welcome. Thank you for saying yes. So at first glance, people might be wondering okay, food distribution, what does that really have to do with substance use and its prevention? And on the surface, I think some people could say, they don't really have anything to do with each other. But you and I both know that they have a hell of a lot to do with each other, because you're talking about access and you're talking about external factors that might drive people to substances. And one of those factors is hunger. Hunger. So at St. Louis Area Foodbank, you all distribute food through lots of different mechanisms. But we were talking ahead of time, and you're looking to do more than just distribute food.
We are. So the St. Louis Area Foodbank has been around since 1975. And we serve 26 counties, 14 in Missouri and 12 in Illinois. And we have had the honor of serving our community for that many years. But what we've also seen is that despite the increase in food that's going out of our doors, we're not seeing the numbers go down as quickly as we had hoped. We started to see the numbers going down pre-COVID, and so we were celebrating some of our new innovations and programs, which I'm sure we'll get to here in a second.
Yeah, for sure.
But then COVID hit, right? And then numbers just went through the roof. I mean, we had some areas that were 70% higher in terms of the food we were distributing year over year. We're still probably about 30% higher than we were, and we're 2 years into the pandemic. So there's just a lot of factors that drive people to need emergency food assistance. But the exciting news is that we're getting ready to launch a new strategic plan that really is laser focused on nourishing people, empowering communities, and transforming systems, so we will be able to shorten that line and reduce the number of people that need our help in the first place, so we can celebrate people feeling confident and people not needing to ask for help, and celebrating dignity and respect, and celebrating, dare I say, fewer pounds leaving our building, which would be a wonderful, wonderful thing
You
to
want to work
celebrate.
yourself out of a job.
I do.
Ideally. I know, me too. Join the
do.
club.
I
Join
do.
the club.
Because that means good things for our community. That means, more people are breaking cycles of poverty and breaking cycles of food insecurity, which is exactly what we are trying to do at the St. Louis Area Foodbank.
You've talked about COVID, and I don't think there's one interview we've done thus far that hasn't mentioned COVID. And for us at Prevent+Ed, we saw families, people who were hanging on, and then the pandemic hits, they're isolated, they lose their job, they're out of school, whatever it is, and they're not hanging on anymore. And it's almost like folks were hanging on by a thread, but we didn't know it.
Yes.
And then COVID hit, and those threads were snipped, and people needed assistance. And so I can imagine the numbers. I mean, I'm looking at them, right? I'm seeing them. I'm seeing the lines wrapped around buildings for food, and I'm going, wow, I had no idea. But that's kind of short-sighted, isn't it?
It is. The sad reality is that, hunger has been around since...
Yeah, it's not new.
Exactly.
It's not a new phenomenon.
Exactly. And I think what the pandemic showed us was just how many people right here in the bi-state region. I mean, hunger does not discriminate. There's a lot of misnomers that it only exists in certain zip codes or things like that. But, we're really looking at things like rural hunger.
Yes.
And all of those communities, and access, and equitable access, and nutrition, and nutritional security. But what we learned in the pandemic is that there are way more people who are one life event away from needing assistance than even we recognized. And I think the pandemic, people had, to your point, they had a job, and then they went home Friday night, and Monday got the call and said, don't come back, to no fault of their own. And now they're facing struggles, and how do I pay for this, and how do I do this? And unfortunately, when budgets are restricted and people have housing or medical bills or children or dependent, parents who are living, grandparents living with them, food is often the first thing that gets cut from the budget, and people go without, and we don't want anyone to suffer in silence.
I would imagine before COVID, you got a lot of donations at certain times of the year, right? Like holidays, because no one wants people to go without a turkey dinner or whatever. But
Yes.
hunger is not seasonal. It's year round.
That's what we always talk about, and it's interesting that you mention that, because we see a lot of people who think of the food bank and other hunger relief organizations. We are so fortunate that we have almost 600 partners. And when I talk about partners, I talk about our food pantries,
Yes.
our soup kitchens, our transitional housing. They are the heroes of this story. They are on the front lines each and every day, talking to people in their communities, telling us what they need. But when you look at what the work that they're doing, it's often just overshadowed by other things that are out there
Right,
in
right.
the space. But you're right, people think of food around the holidays because food is a uniter.
Yes.
Think of
It
events in your
builds
life.
community.
Yes,
Right.
holidays, Super Bowls, everything, graduations, food is at the epicenter. But what we always talk about is that hunger does not take a holiday. So when the holidays are over, people are still in need of food. I was in an event yesterday we can talk about where we saw lines that we had never seen before in a community that most people might raise an eyebrow when we talk about that. But there's problems with summer hunger when kiddos who normally
Right.
get meals at schools and
Right.
they're no longer there, or when the school shut down for COVID. These are real issues and opportunities that exist. And so we are here to support anyone who is in need 24/7, 365.
Okay, so I want to get into the mechanisms in a second of what that looks like
Yeah.
how people find your organization, but then also how organizations can support
Yes.
what you're doing. But I want to back up a second because you've been using two words, and I know that they're distinct.
Mm-hmm.
So, what is the difference between nutrition and food?
Yes, the age-old question.
Yes.
So we all know what it's like to be hungry, right? If you skip breakfast or you miss a lunch because of a meeting, you kind of start to get those pains sometimes.
Yeah, a hangry.
Hangry, right?
Yeah,
Some
right.
people use that. And so we've all felt hunger, right? The great news is that for many people, you have a solution. You can open a pantry, open a refrigerator. If you have the means, go through a drive-through. You eat some food, you're no longer hungry,
Right.
right?
Right.
So that's not the problem we're trying to address. So then you kind of level up, if you will, to food insecurity, which really just means a lack of access to foods that you need to sustain yourself. You don't know where your next meal is coming from, or when or where that's going to even look like. You may have had a good day today, but if the money's run out on the last week of the month, where are you going to get food from?
Right.
And so that's when you talk about food insecurity. And then you talk about nutritional security, right? And so
That's
now,
that like top tier.
it is.
Okay.
And so now we're really talking about access to healthy and nutritious foods that you need to live your best possible lives. We can sit here right now. I can crack open a box of whatever, Twinkies, Ho-Hos, candy bars, Cheetos, whatever, and we won't be hungry for a while. But that's not really the best things to put into our system. And
It's
again,
not good fuel.
it's not. And we are not trying to be the food police, right? Don't try to take away my brownies from
Yes.
me. We're going to spar.
Got it.
But there's a fine line between that and people who don't have proper nutrition in their diets. And we're talking about fruits and vegetables and protein and dairy so that they can really thrive. So with kids, it's about growing and muscle development and brain development. Adults, seniors, everyone needs to have nutrition. And so that's where we're really talking about leveling up to is how do we do a better job of sourcing and then allowing and ensuring access and equitable access across the bi-state region so anyone that is in need of those types of foods can get them easily.
And so that's really where you and other similar organizations like yourself, that's where you become selective on the types of foods that you receive and distribute, right? Like I have seen some lists that it's like, please, like we don't need ramen. Or like
yes.
we like come on, like we need shelf stable items, we need protein, we need like canned tuna and things like that, because there's only so many things of SpaghettiOs that somebody can eat, right?
Absolutely. And we have lists that we keep updated on our website, the stlfoodbank.org. And it tells you things that we're in need of. And it also tells you about things that you can purchase. A lot of people say, what can I buy? What do you need? And, nothing against ramen noodles. I ate them in college.
Right. I love me some ramen.
But that's not when we talk about nutrition and nutritional security. You're right. We need to focus on how do we get not only shelf-stable foods, but low sodium, low sugar shelf-stable foods. How do we get fresh fruits and vegetables infused into diets and proteins? And there's a lot of education that goes along with that. If you're not used to having certain types of foods in your diet, you can't just give them to someone who doesn't know how to prepare it, doesn't know.
I will never forget, Meredith. So I used to work at a local health department. And we did nutrition, and we offered dietetic services. And we were at a local food pantry in Cedar Hill, the Peace Pantry. Love that organization.
They're a partner of ours.
And someone donated to the Peace Pantry a bunch of Jerusalem artichokes. This was 20 years ago. I didn't know how to use a Jerusalem artichoke. The people who were coming in to shop at the food pantry did not know how to use a Jerusalem artichoke. So guess what? The Jerusalem artichokes sat there. Those poor artichokes.
And they probably got thrown away.
Yes. And so then there was a conversation at the health department and the Peace Pantry. How do we maybe couple that with a recipe?
Yes.
How do we have maybe a cooking demonstration to show people how to prepare it? I'm assuming those are all things that you do and are part in, because the food that's donated, I mean, it's like, yay, these artichokes are great, but then if people don't know how to use them, what are they supposed to do with them?
It's the so what, now what? So we are so proud at the St. Louis Area Food Bank. We now have 3 dietitians on staff.
Ooh,
They
awesome.
are preparing recipes.
I'm such a food nerd,
right?
So this is great. Okay.
Well, so you need to follow us on social media, because they do cooking demos. They make it easy. They
What's your
break it
handles?
down. So stlfoodbank.org or at stlfoodbank on all the social media platforms. And our team does an amazing job of making recipes fun and engaging and simple but healthy and nutritious. And so you may have seen this that you got today. Let me show you what to do with it. We also include recipes in our senior boxes. So if you've ever been out to the food bank and you see kind of the assembly line, if you will, of us putting together boxes, 13,000 every month that we're delivering to seniors in the bi-state region, we're also including recipe cards with what do you do with the items in the box that you received today.
Love
so it's
that.
a box of
It's like HelloFresh before HelloFresh was a thing.
It is. And it's so great. We were the original.
No kidding.
And so it's great. So they get this box of shelf stable. They get fruits and vegetables. They get their proteins and dairies. And now they know what to do with it.
That's awesome.
And it makes it fun and easy and healthy.
And then you're also minimizing food waste, which is kind of a secondary outcome.
That's our biggest competitor is the trash can. If people get food and they either don't know what to do with it, don't know how to prepare it, or don't like it, it gets thrown away, which is just a travesty. So that's another area we're trying to tackle.
So food comes to you through drives, donations, whatever, and then it's up to you and your staff to distribute to your partners in the 26 counties.
Yeah, we're getting food literally from all over the country. We have an incredible sourcing team, and they are out there. They are talking to farmers. They're talking to people in ag. They're talking to local partners, and we're getting food in because we're listening to our communities. And if they say, we don't need green beans anymore, but we need more cauliflower, or we need more carrots, or whatever it is, we're listening. We're listening to ensure we're sourcing culturally appropriate foods, right? To meet the needs and the culturally, specific items that some people might need and not have access to. So we're listening more, which I'm very, very proud of the team.
So you said something when you first started talking that I wrote down because it is how I would describe you. You said, no, it's good. And by the way, full disclosure, you and I were in a cohort together of so you've become an executive director, now what? And I think you've seen me cry and curse and all the things.
All the above.
And you have been a reason that I've been able to keep going, because I think I can commiserate with you, and we can support each other. But you said we are laser focused.
We are.
And I think that is how I would describe you. You are laser focused. Does that come from your training and background in the Army? Was that before? Is that why you went into the Army? I mean, you are running a ship now that is big, but it is, as an outside observer, more focused than it's ever been. You have a clear vision for what you're trying to do and who you want to be on your team and how you want to do it and who you want to partner with. Have you always been that laser focused? Teach me. Teach me, Meredith.
Well, thank you for recognizing that. You know, we are so fortunate to have such an incredible team. We have people that are doing this work for the right reasons.
Yeah.
They have such huge hearts. I mean, we have a crew of drivers that are on the road, you know, sometimes 200 plus miles a day. But to our pantry partners, they are the food bank. You know, there are many that I haven't met yet, but they know my driver, insert name,
it's
he or
that
she.
Relationship.
And it is all about relationship, and they care so deeply. You know, when COVID hit, we had two goals. One was keep the team safe, and two was keep the doors open. And we were one of the few food banks in the Feeding America network that can say we did that. But they were so committed. You know, we were like, okay, well, we're going to shut down for a day and give everyone a break. They're like, no, we have to feed the people. We have to do this. And so they share that commitment. But I think what we've seen over the past few years is just really honing in that focus to say, look, if in 1975 the problem was hunger and the solution was food, we should have solved that a long time ago.
Right.
You know, we distributed 135,000 pounds our first year in 1975.
Whoa.
You know, now we're north of 50 million, almost 60 million, yet there's still hunger. So it really caused us to, you know, question conventional wisdom. Are we sure that that's the answer? And so we have an amazing, incredible team. We have an amazing board of directors who lean in and ask us tough questions.
That was the right thing to say.
I love our board. I would put our board against anyone in this community,
awesome.
and they will absolutely rock it. There's such an amazing group of men and women. But I think it's all of us coming together to realize at the end of the day, none of this is about the food bank. We are one piece of a much bigger puzzle. It's about the people we serve. And when you partner with people, when you collaborate with people, when you ideate, when you're not afraid to fail, because you know what you're doing is from a place of goodness and good intentions, and you put your egos aside. You check that at the door. It's not about Meredith. It's not even about the food bank. You know, it's about the people who need us, the people who were out there yesterday in the freezing cold at Mid-Rivers Mall in St. Charles County that waited 2.5 hours for food. That's why we do. And the hugs and the tears and the thank yous and the God bless you for what you do, that is real. And that was yesterday. And that was at Mid-Rivers Mall in St. Charles.
I am incredibly inspired by your leadership. I really mean that. And I think it is admirable that instead of going wider, you're going deeper. At least that's my perception of it. I also think that, you know, I just can speak for the 26 counties that you serve and just say thank you to you and to the entire food bank team for providing food that helps us survive, but also nutrition that helps us thrive. Like, I just am really grateful for everything that you all do. So thank you.
No, it is truly, it's an honor. Anyone who follows me on social media or blogs knows that my hashtag is food and hope. Because food is, yes, it's something that you can touch and literally internalize. But it's the hope. It's what that meal, and it's not that we're trying to give handouts. It's hand up. You know, we're trying to say, hey, let's help you so that your tomorrow can be better than your today. I mean, yesterday we had this couple, I shared this before we went on, and they were waiting in line, younger couple, engaged, and while they were waiting in line, the woman decided she didn't want to sit in the car anymore, so she jumped out and started helping us and started passing out food. They drove through the line, got their food. Her fiance then got out of the car, and they volunteered with us the rest of the morning. Comes to find out that they're both homeless right now. But they were so compelled. They said, look, you know, we need the help, but look at all these other hundreds of families that are here. They need help too, and we're able-bodied. We can do something about this. And so it's stories like that that really just touch you, and the best of humanity is on display at some of these events, because you're reaching people in some of their darkest hours, but the hope you're providing them and the relief.
The relief.
You know, the woman who I was talking to saying, I'm so grateful you're here today. I have 5 kids and 3 cans of ravioli left.
I mean, it's hunger relief, but it's so much more.
It is
it's
so much
mental
more than the
relief.
food.
It's, you know, if you go back, I don't mean to get too philosophical here, but if you're looking at Maslow's hierarchy, you know, you can't expect people to get to their full self if they don't know where their next meal is coming from, and they don't know where they're going to sleep, and they don't feel safe.
No, that's why we opened our school markets, piloted those a few years ago, and now they're just booming because...
I love those.
I
Okay,
know,
can
right?
you come back and talk about those?
We have to, because they're doing such good in our schools, and they're helping our nurses who are seeing just dozens and dozens of kids every day for illnesses.
Yep.
They weren't sick, they were hungry, Nicole.
Yes.
These are kiddos.
As an educator, I know I often had a supply of granola bars and things because my students were hungry.
Yeah.
And you can't learn, much less even
No.
like interact and be a human if your belly is grumbling.
No, and everybody deserves a chance to live their best possible lives. That's what we're trying to do.
But you have to come back. Thank
I would
you
love to.
so much for joining the conversation, for being part of this, and for serving the community. Thank you. If you liked this conversation, if you want more with Meredith, if you want to learn more about the St. Louis Area Food Bank, please consider rating, reviewing, and subscribing. Thank you for listening. Have a wonderful day.